Hey everyone, welcome back to metacytosis. Today we're going to go through a question that's really high yield for your embryology on your step 1. It can come up in your step 2 as well because it's very high yield, and we'll do some high yield tie-ins as well. So we have a full-term newborn develop severe respiratory distress minutes after birth. On exam, the abdomen appears scaphoid and breath sounds are absent on the left side. A chest X-ray shows dilated loops of bowel in the thoracic cavity and a mediastinal shift to the right. Which of the following embryological defects most likely cause this condition? Okay, so we'll go through the diagnosis first, all right? So the diagnosis here is going to be a congenital diaphragmatic hernia. What this means is that there's going to be abdominal contents in the thoracic cavity. So that looks like respiratory distress at birth, a scaphoid abdomen because of the abdominal contents in the chest. You get absent breath sounds on the left because it most often occurs on the left-hand side. The reason for that is because you have the liver on the right-hand side that kind of protects this from happening as well. Then you have, on chest X-ray, bowel in the thoracic cavity, which causes mediastinal shift. So with that in mind, the answer is going to be B, which is a failure of the pleuroperitoneal membrane to close, and that basically leads to something called pulmonary hypoplasia, which means that the lungs don't form properly and is a major cause of mortality for children, newborns. One other thing which is really high yield I have to mention is that you get pulmonary hypoplasia, which is often tested in one other condition, which is Potter sequence. That's caused from bilateral renal agenesis, which leads to oligohydramnios, which is essentially decreased amniotic fluid, and that then leads to pulmonary hypoplasia. So you need to know this condition and that one, and need to know when it comes up in a question. We might make a question like that in the future. So let's go through some of the other options here. So option A is a failure of the septum transversum to develop. That's essentially just the central tendon of the diaphragm. It's never tested. I've never seen it in a question, so I would say it's kind of a distractor. Option C, failure of the Vitelline duct to obliterate. This is Meckel's diverticulum. Remember the rule of twos. Drop them in the comments below if you remember them. And then here you get a true diverticulum. It often has like ectopic gastric tissue or pancreatic cells that release things there, causes pain in a child, and is kind of mimics appendicitis. And the last one is option D, which is Hirschsprung disease. So that's the incomplete migration of neural crest cells. So that's it for today. Hope this helps, and cheers.